South Carolina's Department of Public Health says almost 15,000 people, including about 200 kids and teens, are living with HIV infection or AIDS here in South Carolina.
For 51% of new HIV cases each year, this according to the CDC. Some regions throughout the South also lag in providing HIV preventative services and care.
I found out I was HIV positive after noticing strange spots on my body and experiencing high fever. It all started after a night out with my friend. I remember drinking way too much, definitely more than I should have.
15,000 people tested positive for HIV in South Carolina. The worst part about this is that the numbers are even higher. You have to factor in the people who don't get tested. When you factor in that 15,000 people tested positive, yet you got a lot of people running around who ain't never been tested, don't go to the doctor, have no idea what they got. When you add in those numbers, it's crazy. A lot of y'all need to do yourself a favor and go ahead and get on PrEP or whatever these preventative medication commercials that they keep showing, because a lot of y'all are reckless. You reckless and you careless. You don't go to the doctor. You don't ask for test results. You participate in unprotected sex. I used to get on this app all the time and speak against casual sex. You know why? Because there's nothing casual about something that creates life and something that can give you a disease that you can't get rid of. There's nothing casual about it. I don't care how liberated you want to sit up and say you are. I don't care how free you want to be. When it comes to protecting yourself and your body, you cannot be reckless and careless. You just can't be, right? So be prepared for these numbers to rise and these numbers to be even more astronomical, because this is a careless generation. You don't care about yourself. You don't care about the people you involve yourself with. You don't ask for no test results. You don't look into going to the doctor unless there's something wrong with you, an emergency, or if you got an obvious disease that somebody done gave you. That's the only time y'all really care, right? Seems like ever since y'all seen Magic Johnson still alive, y'all think this stuff ain't real. But remember, you ain't got his type of money.
15,000 people in South Carolina are living with HIV. And no, that number doesn't just mean your uncle who refuses to use hand sanitizer. We're talking kids, teens, adults, everyone. And yet some folks still treat testing like it's scarier than their ex's group chat. Let's get into it. The South. Beautiful beaches, sweet tea, barbecue that'll ruin your shirt in 2 bites. And apparently one of the highest rates of new HIV cases in the country. That's not exactly a tourism slogan, but it's reality. And here's the kicker. The CDC says everyone between 13 and 64 should get tested at least once. Which means if you're old enough to drive, pay taxes, or argue about college football, you're old enough to know your status.
So recently, this started appearing in my hand. I've been taking my medications the way I'm supposed to, although the only thing that has changed is because I've not been eating so well as I used to. So I've been seeing some reactions. I don't know, I really do not know why, but I know that whenever I take my medication without eating, my eye starts to turn me, and I don't know why this is coming out. But this also means that I need a job, guys. I need a job so I can be able to eat well, take more vitamins, and have a very good immune. I don't even know what to say, but I don't know why this is happening now. So as an HIV positive patient, whether you're undetectable or not, you see things like this once in a while. Don't be too startled, right? Just calm. That's what I'm telling myself. It will go soon. But please, someone help me out if you can.
15,000 people done tested positive for HIV in South Carolina, man. That's crazy as a motherfucker. And y'all still out here playing with that fire. Y'all playing with that fire. You think I'm talking about that blick, boy. I'm talking about something that'll kill you alive. That's worse than being killed and dead. Tell me I'm lying. Tell me I'm lying. So if you would rather be just gone out of here unalive, or you'd rather be dead and alive with the HI, shit, boy, 15,000 people. See, y'all didn't even know. See, I'm not the type to tell you stuff that I don't got to tell you, or if it don't come about. The reason this right here is hit hard because I'm from South Carolina. Like that's, you know what I'm saying, born and raised South Carolinian. A lot of people ain't know that. Y'all was asking, where you from? Where you from? You're asking, where you from? Like, if you don't see this video, you'll never know. But if you do, you'll be picking up on game as we go. Like with stuff about me, obviously, I ain't gonna just come out and see it. But when stuff like this happen, where it's kind of in line, yeah. And you say what now? They say 15,000 people. I don't even want to repeat this right here because I'm out in public and people can hear me right now. And I don't like to talk about this because it's like, you know what I'm saying? People start looking at you funny. Like, what the hell he just say? Like, did he just say the HI? Motherfuckers there try to, you know. But nah, though, we ain't gonna repeat that. They'll. South Carolina Department of Public Health says almost 15,000 people, including children. Children. What the fuck? And teens are living with HIV infection or in the state. The spokesperson for Palmetto Community Care, an organization that offers free AIDS, says 8 out of the top 10 states or U.S. territories of new per 100,000 people are considered to be in deep south. Bro, that's crazy as hell, boy. Y'all better get right. Y'all talking about them first dates, a walk. Them first dates need to be damn to the clinic, to the goddamn doc, to see. That's a good first date. Boy, you know how life easy, how smooth and how much I could breathe if everybody make it normal to go on a first date to the doctor, to the clinic. Whether y'all messing around or not, it's just the first date, just to know. Like, we got that out of the way just in case we do take it there. We'll 100% know that we both clean. That makes sense? Like, just because the first date is here, that don't mean we have to go there. That's just letting it be known that we good in case we do. I'm on to something. I know it. New trend. First date to the fucking clinic.
The South continues to rank so high in the per capita diagnosis that we're not making the dent that we should.
The Campaign for Southern Equality's Director of Gender Justice, Ivy Hill, says breaking down a stigma is one of their top priorities.
Out of Malden, where a man is facing charges for exposing someone to HIV. The suspect, Christopher Miller, is also charged with identity theft. Malden police started investigating July 12th when they were called to an apartment complex for a disturbance. They found Miller there. Officers said Miller had warrants out for his arrest and gave them a fake name. While investigating, police say Miller admitted the woman victim was pregnant with his child and he didn't want her to know he had HIV. Miller was booked into the Greenville County Jail. Of course, we'll keep you updated on the
truth. And listen, testing is not a horror movie. It's not like you walk in, the nurse plays a dramatic soundtrack, and someone shouts, "You're positive." Nope. It's quick, simple, usually just a finger prick, less painful than reading Facebook comments. Plus, Palmetto Community Care is literally handing out gift cards for testing. That means you can know your status and buy yourself a celebratory sweet tea afterwards. If Starbucks did that, the line would be wrapped around the block.
Areas with the highest HIV cases in South Carolina. At number 15, it is Sumter, 120 cases. At number 14, it is Rock Hill, 150 cases. At number 13, it is Florence, 200 cases. At number 12, it is Spartanburg, 250 cases. At number 11, it is Goose Creek, 300 cases. At number 10, it is Hilton, Head Island, 350 cases. At number 9, it is Somerville, 400 cases. At number 8, it is North Charleston, 450 cases. At number 7, it is Aiken, 500 cases. At number 6, it is Anderson, 550 cases. At number 5, it is Greenville, 600 cases. At number 4, it is Mount Pleasant, 700 cases. At number 3, it is Myrtle Beach, 800 cases. At number 2, it is Columbia, 1,200 cases. At number 1, it is Charleston, 1,500 cases.
So allegedly there's a woman in South Carolina that's going around passing HIV to men, 12 at that. So just like how y'all asked me, can a man give it to a woman? Can a woman give it to a man? Can a woman give it to a woman? Or can a man give it to a man? Yes, nobody is exempt, baby. So if the story is true, then I just want to let you guys know that, like I said before, there are men and women that are out here spreading HIV and herpes and all other STDs that are out there, you guys, every single day. So that's why it is important for you to know who it is that you're sleeping with, whether it's a one-night stand or a hookup, or whether you're in a situationship, a relationship, polygamous relationship, or whatever the case may be. It is always best to know your status and the person's status that you are sleeping with, because a lot of people ain't gonna be honest with you. On top of a lot of people don't even know that they have these diseases. So y'all, it's a lot of people out here that are laying around sleeping with each other every single day. And who knows, God forbid, I would never want you or anyone to become a victim. But people are still becoming victims, whether I want them to or not, every single day, because of the fact that they are making poor choices like I once did. And that's how I ended up with 5 diseases, you guys. So please take into consideration that just like how men can give it to women, women can give it to men, men can give it to men, and women can give it to women. Nobody is exempt, you guys. So that's why it's always best to know your status. And please go to the clinic and go get tested. Don't go based off of that first test, you guys. Wait another 3 to 6 months and then go get tested again.
Guys, I don't know about you, but it seems like just about everybody that I know is sick right now. I had about 4 or 5 coworkers already this week call out.
I found out I was HIV positive after noticing strange spots on my body and experiencing high fevers. It all started after a night out with my friend. I remember drinking a lot way more than I should have. Things got so out of hand that I completely lost control of what I was doing. My friend tried to get me home safely, but we ended up arguing and she decided to leave. I stayed at the party with some other friends and eventually met this guy. He seemed fun, and the last thing one remember was dancing and having a great time. The next morning, I woke up in his bed, confused and unable to recall most of the night. I left before he woke up, brushing it off like it was no big deal. I thought that night wouldn't have any consequences, but a month later, I started losing a lot of weight. I was constantly running a fever, had terrible headaches, and noticed strange spots appearing on my skin. That's when panic set in. Deep down, had a terrible feeling about what might have happened that night. I decided to go to the hospital, and that's when. Comment if you want to hear part 2.
On July 25th of 2025, reports have confirmed that Health Secretary Robert F. Kennedy Jr. plans to remove every member of the U.S. Preventative Services Task Force, a move that would have devastating consequences for evidence-based medicine and screenings, HIV prevention medications like PrEP, and other essential services at no cost to patients. Their recommendations are based on decades of peer-reviewed research, not politics. Removing the entire panel isn't about reform. It's about silencing science. If you gut this task force, you're gutting the mechanism that ensures patients, especially those in underserved communities, have access to early detection and intervention. You are opening the door for insurance companies to deny coverage for basic screenings, which means more missed cancers, more preventative strokes, more late-stage diagnoses, and more people dying simply because they couldn't afford to catch it early.
The crisis in the Twin Cities since 2020 and in Duluth since 2021. There's an outbreak going on and nobody seems to be talking about this. You may not know this, but the numbers of HIV cases, not only that, but public funding from the government is going to be probably cut by next year, 2025, so we have more cases and less funds to actually treat the epidemic. We need to also understand that HIV affects people that are usually homeless, people that are people of color, and specifically now it's rising among the Latinx community in the United States. So if you're part of the LGBTQ community, if you know someone, if you have met anyone who is living with HIV, or you just don't like how things are going in our...
It is Sunday, August 27th. This week I found out that I have HIV. I was diagnosed on August 23rd. I was diagnosed. Today is my attempt at my first day out. I'm going to the movies with my friend. Had a really hard time. It was really hard to get ready. I don't quite know what I want to do with my story. I don't know if I want to share it. I don't know. My mind is 1,000 places at once. But I wanted to document this in case one day I do decide to share it, so that this part of my journey is seen. I also just want to document this for my own self, to see how far I come, because I know I have a life of trials and tribulations, and I know that this is important. This part of the story is important, whatever I make it. That's really all. I never thought I would be here. I never thought I would be talking, recording myself crying. It's not who I am. But I'm here. I'm at my lowest point. Well, I've been lower, actually, which is surprising. But I'm at a really big crossroad in my life, and I'm just here. And I'm thankful for that.
Atlanta has 20,000 new cases of HIV in 2025 alone. That is in a span of 8 months. That is crazy work, y'all. If you are out here single and experiencing, or you in a relationship that you really don't trust, you ain't been in it for a very much long time, and you know that man is still out here testing things, you need to go get your behind on PrEP, okay? Do not think that PrEP is only for gay men. It is for women. It is for men. It is for teenagers, even the ones in high school over there humping. Y'all need to find yourself on that PrEP stuff. Someone could have it and may not know. Someone may know they have it and just won't say anything. For the gay boys, they say it takes about 7 consistent days of being on PrEP for it to protect you from HIV. And for the heterosexual people, they said it takes about 21 days of consecutive use to protect you from HIV. So I think PrEP needs to be more talked about, okay, because we actually have a medication that people didn't have back in the day. So we need to take advantage of it, because this thing is spreading rapidly.
I had been dating him for over a year. From the beginning of our relationship, he always insisted we be intimate without protection. I kept saying no, mainly because I was scared of getting pregnant. But after a year and 5 months together, I decided to give in. I thought I was giving him something special. Right after we were done, he turned to me with a strange look in his eyes and said, "Congratulations, now you have HIV too." At first, I laughed. I thought it was a dark, twisted joke. I couldn't imagine he was being serious. I didn't want to believe it, so I stayed. I stayed for 5 more years, until my body started to change. I had constant fevers, lost weight rapidly, and strange rashes started appearing everywhere. I finally went to the hospital, and I'll never forget the moment the doctor looked at me and said, "You've tested positive for HIV." I was in shock. I immediately called him crying, and that's when he finally admitted it. He told me he had known all along that he got it from a previous girlfriend, and that he made it his mission to pass it on to every woman he dated. He had already done it to at least 3 other women before me, and I was the 4th. Even though I was heartbroken, even though my world fell apart, I couldn't bring myself to report him because I loved him. Now I live with this virus, and every day is a battle, not just physically, but emotionally. But I'm stronger now, and I share my story not for pity, but to warn others. Protect yourself. Don't ignore red flags, and please choose love that doesn't hurt.
Now, let's kill the myth. HIV is not a death sentence anymore. Medicine has leveled up. People who test positive, get on treatment, and reach undetectable levels can live long, happy lives and can't pass it on. Read that again. Undetectable equals untransmittable. That's science, not wishful thinking. So if you're avoiding testing because you're scared, remember this: not knowing is scarier. Knowledge isn't a punishment, it's a plan.
Man, them folks just said down there in Atlanta, it's been 20,000 new cases of.
I'm here at Christ Community about to pick up my medication for HIV. It's Batarvi and it's a 6-month supply. So I'm waiting on one of the administrators to go back there to the back and get my medicine. Now we're about to open it so I can see what it looks like. This is what it look like. Hold on. Make sure my address and nothing is showing. But Batarvi. And it is a red capsule. Hold on a second. Ugh. I always got the cotton in it. Oh, you better pick that cotton. But
I give you time for everything, man.
But this is what it looks like. It's a GS1 and it has the numbers 9883 on it. So this is what my medication is. It's Batarvi. Like I was saying, my medication comes from Nashville. From Nashville to Memphis, Tennessee, Broad Avenue, Christ Community location for the next 6 months. So that's what the medication looks like, and that's what I have to take in order to remain healthy, living with HIV. So with that being said, you all have a better day.
Shakira Lee made her first appearance in court today on those charges. According to the arrest report, her boyfriend found a paper statement with her name on it and a positive status for HIV. He later found out he was also positive. Channel 4's Destiny McKeever spoke with Lee's neighbor, who says he's surprised Lee would do this. Destiny?
Joy, Shakira Lee sits here in the jail tonight, but back over in her neighborhood. I spoke with people who say they're just shocked to learn of this news, especially knowing that she has young children.
That's horrible.
Disappointed in the news of his neighbor allegedly knowing she was spreading HIV to her partner. Joseph Hamilton says it's hard to trust people these days.
People just have to be careful, you know. Really never know who you're standing next to.
Arrest records show 27-year-old Shakira Lee was arrested for having sex without disclosing her positive HIV status. The report says Lee's boyfriend of 7 years found a paper statement saying Lee tested positive for the disease. According to that same arrest report, her boyfriend later testing positive as well.
So whether you're in Charleston, Columbia, or chilling on Foley Beach, put get tested on your to-do list. Do it for you. Do it for your partner. Heck, do it for that future person you haven't even met yet. Because at the end of the day, the bravest thing you can do in the South isn't wrangle a gator. It's knowing your status. Drop in the comments. Would you get tested if they handed out Chick-fil-A gift cards? Be honest.
Because, I mean, it's been out there, but lately I've just been seeing it back to back, and it just makes me so scared to, you know, be intimate with anybody, which I haven't, okay? Because most days men do not have like a my chart. I don't know where y'all from, but where I'm from is my charts and stuff like that. Men don't have that, and I need a man that be on top of his health. Like, not only do I need to see your my chart, I need to see all your STD results from before you met me, because I need to see what's going on. It's a scary world because a lot of people hide that they have it and it's passing it on to the female. Like, come on. But y'all stay safe out there. It is crazy. You can be married. I just seen a news clip on TikTok of this lady advocating for her mother that died because she married her husband. They've been together for a while and she started getting all this sickness and they thought she had cancer. Come to find out she had full-blown AIDS and died from that. So you can be married in a fully committed relationship and still get it. So it's not about like, oh, no, you can be married and still get it. Y'all be safe out there.
I still hear you crying. 20 minutes go to 2 years. Girl, look how time flying. I mean, just yesterday, who was on the phone talking about retrying? Now it's like every day I gotta make sure I'm not dying.
Okay, so I've been seeing a lot of content about the term bugging coming back around, which honestly it never left. It was just more in at-risk populations and people that suffered with severe mental illnesses. But bugging is absolutely making a comeback. What is bugging? Bugging is when you intentionally infect or you go out seeking to be infected by people that are HIV positive in order to obtain resources under the Ryan White Act. The Ryan White Act, what is that, you may ask? It's basically a subsidy that provides people that are living with HIV and AIDS free housing, Medicaid, medical transportation. You may get a supplement depending on which state that you are in, where you get X amount of dollars per month. And if you don't have rent, you don't have extreme bills or whatever, some people feel like that's a lot of money and they live high off the hog with it. I am here to tell you, back then it was consensual. Not saying that it was right, but it was consensual back then. Now, with the orange man cutting all kind of assistance, where there are some women and men who will get pregnant or impregnate women so that they automatically have low-income housing to live in and resources from the government. Since all of that's being, now you got to go to other measures. Oh, that's crazy. Nobody would do that. First of all, thinking that someone has the same moral compass and mental health awareness that you have is mistake number one. We walk amongst demons. We walk amongst demons. Demons who don't care if they live or die and who they take out with them if they have to die. And if you think someone who wants to live high off the hog will not infect you with something so that they automatically have a place to stay, money coming in from the government, free food, free housing, or housing that's between 0 to I think 200 or something like that. I'm not too sure on the numbers, and then I also get a supplemental check of $2,000 or